afternoon, everybody. I am Sai Kiranmayee, consultant in Vitreo Retina Services from Pushpagiri Eye Institute, Hyderabad. I am going to talk about role of Ranibizumab biosimilar, that is Razumab, in sight-threatening retinopathy of prematurity. There are no financial interests. The aim of the study is to study the role of Ranibizumab biosimilar, that is Razumab, in the treatment of sight-threatening ROP, and also to analyze the duration of regression of the disease after anti-VEGF injection, and to analyze the duration of reactivation of the disease. Coming to methods, it's a retrospective analysis. All the babies with zone 1 and zone 2 posterior sight-threatening ROP who were treated with half-adult dose of Razumab between January 22 to August 23 were included in the study. A hybrid model of optometrist plus retina specialist-based screening was employed. This flow chart shows the screening program where the screening was done at the tertiary eye care center and mostly at the NICUs or the SNCUs. And indirect ophthalmoscopy was used for screening by the retina specialist, and even screening was done by imaging, especially in the remote rural SNCUs which were present far in the rural areas. Coming to the results, 4,620 babies were screened during the study period. Among them, 103 babies had sight-threatening ROP. Among the 103 babies, 41 babies had zone 1 and zone 2 posterior disease who were treated with anti-VEGF, and the remaining were lasered. The babies treated with anti-VEGF were followed weekly. Coming to the regression, all the babies' regression was noted within 1 week, and follow-up, 5 babies expired, 2 babies were lost for follow-up, and 34 babies were followed. These are the pictures showing the pre-anti-VEGF picture where you can see the plus sign and the neovascular network at the junction of avascular vascular retina, and after a week the plus sign and the neovascular network completely regress. This is another picture showing a large network of neovascularization which almost regressed within 1 week after the injection. These are some more pictures showing the regression of the disease. Coming to reactivation, 68 eyes of 34 babies who were followed, 6 eyes completely vascularized, and the remaining 62 eyes were lasered. Among the 62 eyes, 30 eyes were lasered before reactivation because of their remote rural domicile or their inability to follow. The remaining 32 eyes of 16 babies, laser was done after reactivation. So this table shows the baseline characteristics of the 16 babies. You can see that almost all of the babies had aggressive type of ROP, and most of the babies had zone 1 disease, and the age of at which the injection was given was 6 weeks after birth. And this table shows the reactivation of the disease and duration of reactivation, and we can see that most of the reactivation was in zone 2 and mostly in zone 2A. So the time frame between the injection and the reactivation of ROP requiring laser ranged between 30 days to 76 days with a mean of 50 days, which is about 7 weeks, and most of the reactivation was seen between 6 to 8 weeks. So with this, a follow-up schedule was made. The first follow-up was within 1 week after the injection to look for regression and also the adverse effects after injection, and then it was 3 weeks, that is 1 month after the injection, and after that it was a 2-weekly follow-up. And intense monitoring was considered between 6 to 8 weeks post-injection, as reactivation was frequently noticed during this period. So these are the pictures showing laser after anti-VEGF and after reactivation. This picture shows the aggressive type of ROP, and if laser was done directly without anti-VEGF except for the central macular area, the whole retina would have been lasered, whereas with anti-VEGF the functional retina preserved is more. So to conclude with, Ranibizumab biosimilar is safe, effective and economical in treatment of zone 1 and zone 2 posterior sight-threatening ROP as an initial modality of management. Reactivation, which needs to be considered as a rule after anti-VEGF injection, occurred mostly between 6 to 8 weeks in most of the babies. The predictable reactivation timeline enables a more efficient follow-up scheduling, buys valuable time for the baby to recover from the risk factors, potentially improving the compliance and timely intervention. The sequential approach of anti-VEGF followed by rescue laser provides a better functional and anatomical outcomes. Thank you.
Very nice paper. I just wanted to ask you, like, we all realize the role of anti-VEGF. How do you think is your study proving the advantage or disadvantage over and above the other anti-VEGFs by using Razumab?
Basically, it is economical compared to the others, and the biosimilar studies are not very much compared to the other molecules, and also we mainly concentrate on the follow-up schedule and the reactivation, because initially we were following weekly looking for the reactivation. By changing the follow-up schedule, because our babies or were coming from the remote areas, so the compliance was very low when we were asking them to come weekly. So by looking at the reactivation and the period at which the reactivation was occurring, we changed our follow-up schedule, which helped in improving the risk factor, improving the compliance of the parents bringing the babies.
Also, I had one more question just to add to Dr. Manisha's question. So, looking at the medical legal aspect with ROP, is biosimilars approved as such? I just wanted to know that.
It is DGCI approved.
No, for ROP.
It is DGCI approved.
It is approved.
It is approved.
Yes.
Approved for.
By DGCI, yeah.
Right.
Thank you.